Oh, the presentation of by Kaiser. Okay, good.
Good, okay.
Where's the person we're going to be sworn in?
We are gonna, I'm sorry, we have the three presentations. Two of them are canceled. We're gonna have the presentation by Kaiser. They're gonna be phoning in.
Oh, perfect,
We're gonna
perfect.
ask, due to the circumstances, we're gonna ask Gene or the mayor to meet privately with the new commissioners to swear them in, and we can do a ceremonial later if we need to.
Well, that would have been nice. All right, thank you. So at this point, we've already made a motion, and we're moving on. At this point, I'd like to open up the Baldwin Park. Am I ready to go?
Yes,
Okay.
sir. We are ready
At this
to
point,
go.
I'd like to open up the agenda of the Baldwin Park City Council regular meeting. Today is March the 18th, 2020. So I will refer over to the Madam City Clerk, Ms. Jean Ayala, for roll call.
Thank you, Mayor.
Thank you.
Councilmember Ricardo Pacheco.
Present.
David.
Councilmember Monica Garcia.
Here.
Councilmember Alejandra Avila.
Here.
Mayor Pro Tem Paul Hernandez.
Present.
And Mayor Manuel Lozano.
President, thank you very much. At this point, I'd like to let everyone know that Councilmember Monica Garcia and also our legal counsel, Mr. Robert Tafoyo, are joining on via phone at this point. Thank you. So at this point, I will go ahead and go into the, actually, allow me to open up public communication at this time, and this will get a presentation.
Are
So
we going to
this,
do the flag salute?
yeah, we did the flag salute, so I guess we could go ahead and do it for the city council. We did it for that. Thank you very much, Councilmember Alejandra Avila. At this moment, I'll ask everyone to please stand, and we'll face the flag. Place your right hand over your heart. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Good evening. At this point, I'd like to open up the public communication, so anyone would...
Invocation.
Yes, we definitely need it at this
We
point.
need it at this point.
Yes, I know we do. Thank you. Councilmember Ricardo Pacheco will lead us in an invocation. Thank you.
Thank you, Mayor. Please bow your heads. Heavenly Father, we are here before you, the City Council, to provide leadership for this community. And we ask you to give us the guidance and direction for our president, for our leaders in the state Congress, in the state, and here at the local level. Protect our police officers, our firefighters, and all those that are first responders. And especially in this time, we ask you to watch over those and bless those that have this disease that is coming throughout the world. And we ask you to watch over all of us and get us safely through this. Amen.
Thank you very much, Councilman Ricardo Pacheco. At this point, I will now open a public communication. Anyone wishing to speak, please state your name, your address, your name. You have 3 minutes. The address used to be years ago. See no interest, I now declare the...
Calling somebody. It's
Oh,
gonna
thank
take
you.
a little bit for them to come.
Oh, thank you. Well, you know what, let's just go ahead and bring him up here. I mean, right in that area.
Microphone set up there.
Yes, they're
Okay.
Bring them
up
to
the
the
stage.
top.
Okay. All right, so at this point, I'd like to declare the public communication closed. Thank you very much. All right, so at this point, we'll go ahead and go into the the agenda items that we have. We have the presentation, I believe, online from Kaiser. Am I correct?
Yes, we're gonna dial into.
We're going to dial in. Thank you. Appreciate
And he
that.
will speak and have a present PowerPoint.
Want to, first of all, thank David, our IT person. The presentation will be held by Dr. Jack Chow.
Oh, this is Jack Chow.
Thank you. Dr. Chow, thank you very much for joining us. This is Manuel Lozano, the Mayor of Baldwin Park. You're also joined by Vice Mayor Hernandez, Councilmember Monica Garcia, and also Councilmember Alejandra Avila and Councilmember Ricardo Pacheco. So thank you very much for giving us the opportunity to be able to go online and hear from your expertise and your level about the coronavirus. Thank you, Doctor.
Well, wonderful. Thank you for inviting me. And do I have this slide up here? that you can see?
Yes.
Yes, it is, Doctor.
Okay, wonderful, and someone will hopefully drive that slide. And I want to thank you all for the opportunity to update the City Council as well as the community. I hope that they're joining virtually and that we're doing appropriate social distancing as we're heading into this novel coronavirus situation that many, not just federal, state, but local states of emergencies has been declared. I just wanted to take this opportunity to inform you and the public of the situation, what we are doing, and the ask would be what you can do as a council and as a community to help us sustain the healthcare delivery for our community. Next page, please. So what is novel coronavirus? Just to keep this thing in perspective, next slide, yes. What is COVID-19? COVID-19 is a term for this novel coronavirus. We know that we do have coronavirus. So the first thing that we need to set things straight is that coronavirus is not new. There is a novel strain of coronavirus. We know that since the 1970s, there are 4 strains that normally circulate that causes common colds. And that usually takes about 10 to 30% of the winter common colds are coronaviruses. And unfortunately, coronavirus in the past did not cause severe diseases, with the exception of that SARS outbreak in 2002 and MERS outbreak in the Middle East after that, and the current novel coronavirus, what we're calling the disease as COVID-19. So the COVID-19 is a disease describing the symptoms of this novel coronavirus. The novel coronavirus was first identified in 2019, and that's why it's 2019. This was discovered in the middle of December in China, and has since spread, and now it's a pandemic. The primary symptoms includes fever, and it's fever of 100 Fahrenheit or above, 100.0 Fahrenheit above. The cough is generally a dry cough. Now, there was initially some fear and controversy about how it spread. What we know now is that this is a regular respiratory droplet from person to person, meaning that unlike measles, where it's airborne and anyone potentially that comes through an enclosed room can get it, it's a respiratory droplet that's transferred from person to person. As a person is coughing or sneezing forcefully, the air with the droplet is expelled up to 6 feet or 2 meters in distance. And because this is a droplet, it could potentially land on a solid surface and remain there until that droplet gets dried and evaporated. And that could take perhaps an hour or 2. It depends on humidity. And so if a person touches the solid surface and then touches their mouth or nose or face, potentially the person can contract this disease. So the current risk is that we know that community spread are being reported. The risk level is dependent on what we know that Bay Area is in a shelter-in-place mode. We know that Southern California, we have reported cases. Healthcare workers, we have cases demonstrating that healthcare workers who are caring for patients are at elevated risk, and some are being exposed. And we have, unfortunately, some cases of healthcare workers that are diagnosed with this. Also, as the cases are being reported, there have been cases of close contacts with person-to-person transmission. So they are at elevated risk of exposure. Next slide, please. I enclosed some of the latest statistics, but I just want to let you know when I submitted the slide, and since that time, the numbers have changed, and this is to emphasize that this is a very fluid situation. It is continuing to evolve. You are hearing that some experts are saying that we are about a week or two behind Italy. I think, and the fact, the trajectory is that when I submitted the slide a couple of days ago, we only have 3,487 cases reported. As of now, we have 9,261 cases. Total deaths was at 68 nationwide. Now we're up to 150. Specifically in California, as of March 15, we have 392 cases. I just checked, the last count was 848 cases. And with 16 deaths as of now. Next slide. So this is a very scary situation. I'm sure your residents, and there's a lot of questions. The number one thing as a council, as officials, as public and folks in the public, we need to make sure that we remind folks, do not panic. The CDC has recommended, and because this is a droplet transmitted disease, we can do something about it. We can do something about it by washing our hands. Make sure that we do it for at least 20 seconds. If hand washing is unavailable, alcohol-based hand sanitizers that's greater than 60% in concentration is also effective. Very importantly, though, most of us don't realize that we touch on the average at least 3 times an hour when we touch our face. Up to, some studies even says, 15 to 50 times we're touching our eyes, nose, and mouth. Okay? Making sure that hand washing and remind ourselves not to touch our eyes, nose, and mouth is very important. Third point, if people are sick, we want to avoid contact with those folks. We want to recommend for folks to stay home if they're sick. In the past, we're a little sick. Maybe I can touch the wrist. I got the flu. Maybe I can touch the wrist. Heed the call. Stay home if you're sick, except to try to get to us. And we'll talk a little bit about that, how to get to us. Keep sick children home from school. I know that in the LA County, my home included, my kids are at home, and I think that's a great move in mitigating further spread. What we know is that winter season, colds and flus, kids are usually the source of mixing. Those of you who have preschool kids know that every season around wintertime, they always come back with these bugs and spread around the household. So the decision to keep kids out of school and prevent spreading amongst kids was the correct one, I believe. Keeping sick children home, keeping sick people home to avoid spread is a great mitigation effort. If in case that someone gets sick, cover their mouth and nose with a tissue, or if there's no, if a tissue is unavailable, coughing into the elbows would be an alternative. Throw that tissue away. Don't reuse it. Or if you have a handkerchief, wash it. Try not to contaminate other surfaces. And clean and disinfect common objects and surfaces that we touch all the time. Is very important. For our clinicians, we learn to clean our stethoscopes, clean our, for folks, cleaning your keyboard that you touch all the time. When you're at home, keeping the countertops clean. Okay? Common things. Don't share common stuff such as bowls and spoons, silverware. These are keys to mitigate transmission of further infections. Talking about symptoms, please call or contact your healthcare providers. And very importantly, we need to get the word out. Please don't walk into a facility when you're sick without letting us know ahead of time, especially if you have suspicious symptoms. For Kaiser Permanente members, they can call the call center, and what we're doing as not just within Kaiser community, but as we ramp up in the healthcare community. And so we're increasing our efforts for telemedicine, be able to call your doctor, be able to ask us to get care remotely. Lastly, be prepared at home. Have a plan in case you get sick. If you're caring for a family member and get sick, how do you isolate yourself? How do you provide care for that family members without the other family members get sick? Next slide, please. So what is Kaiser Permanente doing in terms of heading on, preparing for this outbreak? Well, we've activated our national, regional, and local command centers at Kaiser Baldwin Park. When I'm working, our command center has been activated since Monday. Our senior leaders, and along with our labor leaders across our organization, we're meeting regularly. For a fact, I'm being updated 3 times a day as this condition evolves. We've activated 24/7 command centers that's focusing on the evolution of the outbreak, where we're at, looking at supply chain issues, managing those inventories, and working together with federal, CDC, state, CDPH, the Public Health Department, and local health departments in appropriate coronavirus response plans. We have protective equipment. We have protocol for screening, isolation. Some of you may have experienced in recent days coming onto our Kaiser Baldwin Park campus. We've instituted specific procedures, screening, testing, and isolation. Next page. We have these processes because we want to protect our members and patients. And we're working with our community to communicate out these necessary information. We have information on websites for Kaiser community members as well as non-members. We have internally learning modules for our employees and staff. We have gone through environmental health and safety training. All of us were signed off on this. Our active command center is coordinating as information is updated. We're disseminating that to all the frontline providers. We have department-specific trainings to head off any potential complications. We're looking at what we may potentially receive as in terms of catastrophic or disaster planning, and we're planning ahead, really looking at how do we retool for a potential surge of patients. And lastly, we retool our call center and member services to respond to increased patient inquiries and concerns and address those issues because we want to get the facts out there. We have ongoing updates at kp.org with regards to this issue. Next, please. And so I wanted to mention about some myths. There's, as a primary care physician, and there's a media swirl out there, an internet media swirl. Things, there are some myths that are being perpetuated. Well, number one is that a vaccine is available at this point. Well, currently there is not an approved vaccine for use. However, we, Kaiser Permanente as an organization, and Kaiser Permanente Washington Health Research Institute is starting phase 1 clinical trial, human clinical trial, to see if a vaccine that's been selected would be safe. Now, with any type of vaccines, there will be 3 phases of vaccine trials to demonstrate safety, efficacy, and to make sure that there are no significant side effects before we can have it for public use. And so, yes, there are potential vaccines, but no, a vaccine currently is not available. Myth number 2, face masks will protect you from COVID-19. Well, in certain cases, yes, higher risk populations, face masks will decrease the risk versus no face mask at all. So if you're in close contact with someone's coughing on you. But what we know is actually face masks, wearing face masks for folks who are sick protects those folks who are not sick better than for those healthy people wearing face masks. And the reason being this, is someone who's not wearing a face mask, who has a respiratory condition, as they're coughing, the face mask will block some droplet particles. At the same time, the droplet particles may land on the healthy person's face, or the healthy person may, as I mentioned before, touch solid surfaces and then later on transfer. Another common mistake for folks is to think, this N95 mask, so that N95 mask means that it blocks up to 95% of all these fine particulates, and so it will will protect us better than a regular surgical mask. Well, the fact is that anytime you have a mask, but then if you do not follow appropriate protocols and having a hand touching the mask, adjusting the mask, and then having your hand transfer those droplet particles to other parts of the face, well, really negates the protection of that face mask. If someone wants to wear a mask, it's okay, but right now I know that in the general community, we are short of N95 masks. We are short of masks in general. And what we are urging folks to do is not to hoard these. We have communities who recently acquired stock of masks and due to good reasons. We have communities with the recent fires, and during that time, some folks may have purchased boxes of masks for their use. Well, this may be a time to think about all in one community to band together and supply those excess masks and to redistribute it to folks who need them. Myth number 3, we are running out of prescription drugs. I've seen personally that within Kaiser Permanente and out there's a myth that we're running out of drugs. Well, Kaiser Permanente at this moment is not experiencing any significant drug shortages relating to this issue. There have been runs on certain items that you see in media, right? The fear of coronavirus, we've seen that some pharmacy outlets are running short of common cold and cough medicines. Medications that really we need to band together as a community not to hoard, because there may be other members of the community that requires these additional medications. So next page, please. So lastly, I want you to know that masking, for sick people, yes, please do, but please don't hoard the masks. Number 2 is please avoid non-essential air travel, business travel. I know that the federal administration has recommended a limited number of gatherings. You're doing this virtually. Thank you for doing that. We want to make sure that folks are not gathering unnecessarily. Convert to video and visits or postpone to other days. Make sure that folks know that they should stay home and contact us when they're sick. And then, as I want to reiterate, pharmacies, please don't rush to the pharmacies and try to hoard these necessary medications for the health of the community. As an organization, we want to make sure that we preserve the health care workforce. And so one last ask that's not on here is we are actively looking at our healthcare workers exposed to this. We are looking at guidelines to make sure that healthcare workers will continue to work. We want to protect the general public and keep people staying home. We want to make sure that the first responders and healthcare workers are not unnecessarily furloughed for just minor symptoms, or they have fears and concerns, because every body will count as we head into a possible surge. Thank you. Any questions? That's the end of my presentation.
Yeah, Doctor, this is Manuel Lozano. Question that I have, so it's been ruled out that it's not airborne contaminant, it's more of the droplets. So we're in the chamber, city council chamber here, so it's not airborne, so we're protected. However, it's the droplets that would have the effective, the person that was carrying the actual COVID-19. Am I correct?
Yes, you're absolutely correct. So if you're sitting 6 feet apart, you're absolutely safe.
Could you repeat that, please, Doctor?
If you're sitting 6 feet apart,
Yes.
you're safe.
Okay.
The common sense. So the difference between airborne versus droplet is that if you provide some safe distance, as the person coughs or sneezes, the droplet by gravity will ensure that it drops. And we know that about 6 feet is a safe distance. Versus airborne are small particles that will linger within an enclosed room. So if you're in a chamber and if this is airborne, so my example would be if someone has, you remember those old days where we have chickenpox parties,
Right.
Chickenpox is airborne, so someone has chickenpox and, they would bring other kids to get chickenpox, okay, or same thing with measles earlier than that, vaccines. And so those viral particles will linger, and they linger in a room for 2, 3, 4 hours, depends on the virus. Not this one.
Thank you. Now, Doctor, one more last question that I have. The N95, which is the actual mask itself that seals off the entire face, which, first of all, is very uncomfortable to wear. Obviously does seal off any particles in the air and liquid versus a typical mask that just someone places over themselves. Again, you're seeing so many people with different types of masks up, and obviously N95 is probably the best, but CDC doesn't recommend it unless you're working in the health industry and dealing with individuals that potentially may be affected by COVID-19. Am I correct?
So actually, N95 is only recommended when there are potential for aerosolizing. So when we are inducing sputum, or if we're putting a tube down someone's throat, and potentially that fine hair particle could spray, we recommend N95. Otherwise, for this condition, regular surgical mask plus a face shield or a goggle are important. So this is the differentiator. N95 alone versus surgical mask alone for this condition, one or the other, no added benefit. Face mask or goggle plus a mask is actually the preferred personal protection equipment. Okay, so PPE-wise for this type of condition, so let's say if you have a first responder who's worried and trying to assist a person who may have this condition, we recommend not just a regular surgical mask. N95 really doesn't add additional protection. It's that they wear a goggle or a face shield on top of that. Okay? That's where the protection is. But the other key point is doffing, meaning taking off the protective equipment is very important, because there's a sequence that we're trained to do to take off those protective equipment. So you can be protected, but if you're taking this off incorrectly and you're getting the droplet particles on your hands, and then later on you're taking things off and you're touching your eyes or mouth or nose, then essentially there's no protection at all.
Doctor, I have another question. I'm kind of curious. South Korea, 20,000 are tested per day versus here. I know we're way behind based on the fact that the White House obviously didn't join or didn't listen to the World Organization Health, or I don't know if I'm saying that correctly. So it seems like we're behind. What is your anticipated, I don't know, you probably don't know, but when we're on a massive scale, so say that individuals would like to be tested?
Yeah, and I don't know. and we're
Well,
not finding blame. It is what it is. We're in a situation where we do not have testing capacity at this point.
Yes, sad.
And unfortunately, we are ramping up testing capacity. In Kaiser Permanente, we do have some tests through Quest Labs. And I know that there was a federal action to increase the amount of production of these. We are short on reagents. We're short on things that we can swabs to swab folks. There are newer techniques in collecting specimens, and then we're just waiting for labs to ramp up on those test kits. And so it is a supply issue, but I do see that there are some movements. I know that Quest in Southern California has increased the number of available test kits. Obviously, we're not at the same level as South Korea. And I know that the federal government is trying to rapidly clear the FDA hurdles to allow more and more testing to be done. I think one day, soon we will get to that point. At this moment, we are behind. I don't have a timeline as to when this will be, as rapidly available as other countries.
So let me, a hypothetical question. Someone has respiratory issues, short on breathing and what have you. They show up at Kaiser. Are these individuals, and meet the criteria, I should say, are they immediately isolated? What steps does Kaiser take? That's a question coming online right now, by the way, Doctor.
So this is what we're doing, is that we have actually a couple of weeks ago, we instituted a survey, so every person who checks in with us are asked standard questions for screening, and now, as of Monday, we are extending to all visitors. We have policies in all of our facilities to have at the entry points, we have a nurse and a staff asking all visitors the standard screening questions. If they screen for any yes, we have a process to take them aside for a secondary screening with our health professionals. And if any one of them may potentially have this condition, then we will book them a remote appointment, telephone appointment with one of our physicians, and we will go further into diving into their history and if there are high-risk testing if necessary. And so we do have a process to help our community members, our Kaiser Permanente members who visit us. I know that other facilities and other health systems are also instituting similar questionnaires and screenings.
Shannon, I went ahead and dropped it.
At this point, I want to thank you very much, Doctor, for joining us on this very educational, and we will place the slides that were presented here online as well. Council members have any questions?
Yes, Mayor.
Yes, Councilmember Ricardo Pacheco has a question, Doctor.
Yes, Doctor, I'm Councilman Pacheco. Thank you for being here and talking to us today and getting this information out. I also want to thank Kaiser for their help in the community and all that you guys are doing to help with this virus. My question here is, what do you recommend for airplane travel? Should it be avoided, or do the airplanes have enough capacity to clean the air while you're in the cabin?
Can we I'm sorry, Councilmember.
Councilmember Ricardo Pacheco, Doctor, is indicating, is it safe to travel by plane? Or what recommendations you may have regarding that?
Well, and so, as with air travel, the airplane itself is very safe. Okay? I'm just going to say that because we know that airplanes bring in fresh air, they're HEPA filtered, they're safe. The issue here is the distance between the seats. So what happens is 6 feet goes right within, and at this moment, I don't know how airlines will control feeding, and so there may be a chance that you're sitting in closer proximity to another person. And I know that many airlines are now canceling flights to reduce this risk. And I would strongly recommend folks not to take unnecessary air travel just because we don't have control over who's going to be sitting next to us or 6 feet away. And so 6 feet in an airplane nowadays, it's about, 3 rows before, in front of you and 3 rows behind you. And so just think about last time you took an airplane, how many times are you able to have 3 rows in front of you and 3 rows behind you empty?
All right, thank you. Carl.
Another question, can,
You want to come over here?
yeah, can you hear me there?
Yes, sit right here. You got to be 6 feet.
Okay, doctor, can the virus be caught through food? Let's say somebody has the coronavirus and they're serving you something at Starbucks,
Droplets.
and the droplets get in your food and somehow be passed on to you?
So what the question is, are food safe, right?
Yes.
Often your food too. But we know that in general, and this goes to grocery stores, right? People are concerned about groceries, like that. When you go to grocery stores and you're purchasing, let's say, fresh lettuce, things like that, and you're washing it, you're washing the droplets away, okay? You're cooking the food, so you're cooking the viral particles, and in general, it's safe. The issue is the packaging, right? So if someone coughs on that packaging, that surface that sticks, right, and getting that to you, and you happen to contact that surface, and then do not wash your hands and touch your mouth and eyes, so potentially there's transmission there. We don't know exactly how frequently it happens. It's a potential, and that's why we're recommending for anybody. So you mentioned Starbucks. If your employee is sick, tell them, hey, please don't come in. You don't want to infect anybody else. And that goes along with flu, too. Okay, so I just want to remind folks.
Okay, and then,
This novel coronavirus has a higher infective rate. There's a severe disease. It's not, we have to take it seriously. But so do we have to take flu.
very well.
All right, thank you. Anyone else have any questions?
Yes, if we may.
Yes, okay, Vice Mayor, Vice Mayor Hernandez.
You could just ask for, on my behalf, is if it's passable to animals.
Is the coronavirus, the Councilman Hernandez asked, can it be passed to an animal?
And so we know that we don't know, but we're conjecturing that this virus originated as a mixture of mammalian coronavirus and somehow it got transmitted to human beings. So there has not been any evidence in terms of domestic animals, dogs and cats, as a transmissible source, if that's a question. Currently, we know that it's a human-to-human transmission through droplets.
Okay.
All righty, thank you.
My
Yes,
last
go
question
ahead.
real quick is, you may not be able to answer, but what do you think the professionals are looking at in terms of when does this coronavirus start to not be as effective as it is now? Obviously, everybody is staying home right now. We're looking at 2 weeks. But, for the long term, not everybody could stay home and not work. Are there signs that they're looking at to when this disease, maybe when it starts to decrease among the population, we could kind of resume back to normal?
Right, and that's the dilemma right now is that we're still on the upward trajectory. As many of you may have heard Dr. Fauci mention that our national expert, epidemiologist, that all this mitigation strategy that come to any deflection for another week or two, and he's absolutely right. What we're doing now is to mitigate the increase in the next week or two. And so, it's too early to call, but we know that with other countries' example is that once we implement mitigation strategy, once we see the new case number, new cases starts to slow, we're hoping that that will be a signal that we're turning a corner. Now, the China example, now they're facing the dilemma of when exactly to release the general public, to release the general public back to, freely roam and having a secondary peak. But that would be up to the epidemiologist to call. We're still in the early phase, and I would focus the efforts on mitigation, letting the word out that please keep our seniors at a safe distance, keep the kids, not to roam free, especially not the young kids, actually, the young adults who think that they're invincible and they're out, to crowded places, going to bars and restaurants and to hang out outside in a close location, because yes, they may not be as sick, but they potentially can give it to their loved ones who may be at higher risk.
I think at this point we have Councilmember Alejandra Avila.
Thank you, Doctor, for being here with us. So the news says they've been saying that this can last from 3 to 6 months. Also, the governor stated that schools may stay closed until September. How do you see this lasting that long, or do you see it lasting that long?
Like I said, it's hard to say, and I'm not a gambling person, so we have to go day by day. This is, like I said, too early to call. We know that at least next 2 to 3 weeks, if you have travel plans, I would not bank on that. I'm not sure if it's 3 months or 6 months. We're hoping, and this is the issue here, is we have to act decisively. I think the governor did, the local governments, LA County, kudos to all of you that you're making decisive moves to protect the general public. And I think this effort hopefully will bend the trend. We will see that in the next 2 to 3 weeks. It will give us an idea of, are we successful? Because if we're seeing that in 2 to 3 weeks, the trend is slowing down, then I think we would have a more optimistic outlook that this will be lasting shorter. China, started middle of December. They're now seeing the relaxation. And so I know we're not China. I know that we're not South Korea. Italy is still, reeling and dealing with their surge, and we hope we won't run down the path of Italy. But that's the timeline with other countries' examples.
Thank you.
Thank you very much. All right, unless there's any other questions, Doctor, I would like to thank you very much for taking this opportunity. And of course, thank Kaiser, a partner in our community, for taking this, and again, for educating the community in general. So thank you very much.
Well, thank you for the opportunity.
Thank you, Doctor. Bye-bye now.
Good night.
All right, good night. All right, so at this point, we're going to go ahead and go into the agenda that we're going into the presentations have been moved over, am I correct?
Yes, the other presentations have been canceled, and Mayor, I do have items 12, 13, and 14 before you, items that are emergency items and that have come up after the posting of the agenda.
Oh, yes, I'll go ahead and make a motion.
I'd like to have those added on.
To include items 12, 13, and 14. That is my motion.
Second?
Second, any objections? Seeing none, so move. Before I forget, before I actually go on to the next one, just want to say that Cecilia Bernal from the Church of the Redeemer sent a text indicating that the Church of the Redeemer is actively and in full capacity operating and assisting in the community, and it's a very well-known and distinguished church that has contributed immensely to the community. So thank you very much, Cecilia Bernal, if you're hearing me online. Thank you. All right, so at this point, we'll go ahead and go with consent calendars. Council members wishing to pull any items? Yes, the one, okay, so that's including both 12, 13, and 14.
Correct.
All right. Yes, thank you very much. All right, so council members wishing to pull any item? If not at this point, I will go ahead and move for consent calendars, that is my motion.
Second.
Any objections? Seeing none, so move. All right, thank you. At this point, we'll go over to the item, to the 6, City Council acting as successor agency of the dissolved Community Development Commission consent. So which is excuse me, one moment, please. All right, so we have the SA1 successor agency to dissolve Community Development Commission of the City of Baldwin Park and Treasurers Report, January 2020, and we also have the second one, which is the Development Commission of the City of Baldwin Park warrants and demands. So go ahead and make a motion for both SA1 and SA2. That is my motion.
Second?
Any objections? See none, so moved. All right, the last one, reports of officers, 11, introduced ordinance number 1452 as a first reading to amend section 33.05 of the position to list of manager positions identified to subsection B2. So at this point, who is?
And Mayor, I can let you know, so
Sure.
you heard a briefing from the police chief
Yes.
last week about a possible reorganization.
Organization, yes.
This sets the stage for that. That
Okay.
doesn't lock you into it. It's merely adding the position to the municipal code, and we're wanting to get a little jump on that because it requires a first reading, a second
second
reading, and it's not effective for 30 days.
Alrighty.
So it's still, there's opportunities to massage that organization chart a little bit if we need to.
Thank you. Go
Mayor,
ahead.
can
Yes,
we make
yes,
comments on
absolutely. Councilmember Alejandra Avila, and then follow Councilmember Ricardo Pacheco.
Okay, so thank you for that, Mayor. So yes, the presentation was given to us on March 4th, sorry. And at the time of the presentation, City Attorney did advise that it was only a presentation and it was not up for discussion. The presentation was made, however, in order for me to be in agreement with already putting it in as a first reading, I really would like to sit down and have a study session and have more information, because at the time, there was no time for questions, there was no time to even discuss or thoroughly go through the reorganization. And with everything happening, I can't say that I've actually had time to go through the whole thing. I know, Mayor, you mentioned that it was a great report, but we didn't get to see it because it was not added to the agenda until the 3rd at 5:14 in the evening. So I didn't even know it was added until the day of the meeting. So it is very important that I ask for a study session and move this item so we can have time to look at it, discuss it, and then get a better idea of what it is we're having a first reading about. Another thing that was brought up to my attention, and it could be regarding this, it could not be regarding this, I'm just speaking in caution. There was a concern because on March 3rd, 2020, there's a report, a news report, interim chief of police from Santa Paula resigned because of other professional opportunities. What's concerning to me, that's that on March 10th, the attorney for the POA, Mr. Castillo Harper, put in a record request asking for documentation of hiring Mr. Rodriguez, although I know there is no record of that. These items are a little confusing. Why is this coming up? We're already requesting to have an assistant chief of police, and all this is kind of tying in. So I really want to look into everything. I want to make sure that things are being done properly. I know there's an open position for a captain that has not been advertised. This has not been advertised either. There has not been any testing done for any of the positions. So again, I want to move this to another meeting so we can have time to study it and then look at it. And another thing that was brought up to my attention was this new organizational chart looks a lot like the sheriff's department. So the question is, are we looking into going to sheriff? I know we're looking into saving money. We have discussed that hiring more police officers so we don't have to have so much overtime will definitely decrease the amount of money we're spending. So I really like to look into all of that before we continue on putting this as a first reading.
Let me
And that
first-
is my motion.
Okay, there's a motion on the floor. Is there a second? It dies for lack of a second. Let me, first of all, say, the myth of the sheriff's department has been a campaign. It's kind of reminding me someone doing something from behind the closed doors again. This city will not go to the sheriff's department, and we've said that on many occasions. This actual reorganization is no different than the city of Ventura, which has its own police department, and also the city of Santa Ana, which also has a similar. So there's nothing, I think that it's a benefit for the city of Baldwin Park. And I believe that it's in the best interest for us to move forward on it. And as it was stated by the city manager, it doesn't hold us to anything that we can't change in the future. So I'll go ahead and entertain a motion to pass the ordinance itself, and I will read it. It reads the introduced ordinance number 1452 as a first reading to amend section 33.05 of the City of Baldwin Park Municipal Code to include an assistant chief police position to the list of managers positions identified in subsection B2. So that is my motion. Is there a second?
Objection.
Yes.
1 second before.
Yes, go ahead.
I'll second that, but before we take the vote, just for clarification, for, as Councilmember Alejandra pointed out, she certainly has a lot of questions, and
Yes,
they're all valid
we'll bring that
questions. My question is, if we vote today, 2 weeks from now, or whatever the case may be, when this comes back at the time, will we be able to then modify or change anything in the second reading?
Yes, you could. You could choose not to approve it at the second reading, at which time it could die. You could propose revised language. If it's most likely revised language, it would have to be reintroduced as a first reading and come back again for a second reading.
Okay, thank you very much. I feel comfortable
Mayor,
with that.
Yes, go ahead. Okay, there's a motion,
He's still done.
No, I appreciate that. Thank you again.
There's a motion that was seconded. One objection?
Objection.
So at this point, I will ask Madam City Clerk, Ms. Gina Ayala, to take roll call. Thank you.
Councilmember Ricardo Pacheco,
I think you have to go with the motion.
I said, yeah.
sorry, Mayor.
You have to
Lozano.
start. Yes, that's fine. Okay, yes.
Councilman Ricardo Pacheco,
That's the person who said it.
Yeah.
Mayor Pro Tem Paul Hernandez,
Yes.
Councilmember Ricardo Pacheco,
That would be the person who objected.
You're right. Go ahead.
Councilmember Alejandra Avila,
No. And just for clarification, all I want is clarification in a study session. I'm not saying that I don't agree with it, but it's always wise to have clarification before we move forward with anything. Thank you.
Councilmember Ricardo Pacheco.
Before I answer, a quick question. So this is just to add it to the list of managers. It doesn't mean we're going to implement.
That's correct. You could add it to the list and never fill the position. There's actually a couple positions in the code that we don't currently utilize, and we just leave them vacant.
So it's got to go through a budget process to be able to fill it, right?
Correct. It
There's
needs to
no
come
money.
back to the council. You need to approve the job descriptions, you need to approve the organizational chart, and you need to approve any budgeting that goes along with that.
So there's still time for
There's a
questions.
process.
So-
There's too much to go through still.
Okay, so.
Okay, I'll vote yes.
All right, so at this point, the motion passes.
And Councilmember
3-1.
Monica
Oh,
Garcia?
Yes, that's right. Councilmember?
I'm sorry, she had to drop off.
Okay, all right, so the motion is 3-1, so the motion goes through. All right, so at this point, council members have anything to share before I close out the city council meeting?
No.
If not, at this point, I'll go ahead and move for adjournment of the city council. That is my motion.
Second.
Second by Vice Mayor Paul Hernandez. Any objections? See none, so move. At this point, I'd like to open up before I do that, allow me to just read something real quick that I need to read for the record. All right, the councils are also members of the Board of Directors of the Housing Authority and the Finance Authority, which are concurrently convening with the City Council this evening, and each council member is paid an additional stipend of $30 for attending the Housing Authority meeting and $50 attending the Finance Committee. So at this point, I'd like to open up the Baldwin Park Housing Authority, and we have consent calendars, items 1 and 2. I'll go ahead and make a motion to move for consent calendars, items 1 and 2.
Second.
It was second by Councilmember Ricardo Pacheco. Any objections? Seeing none, so move. At this point, I'd like to go ahead and move for adjournment of the Housing Department. That's my motion. Is there a second?
Second.
Second by Vice Mayor Paul Hernandez. Any objections? See none, so move. All right, the next one that we have, I'd like to open up the Baldwin Park Finance Authority. We have consent calendars items 1, which is the treasury report. I'll go ahead and make a motion to move. To approve? Second by Vice Mayor Paul Hernandez. Any objections? Seeing none, so move. At this point, I'll go ahead and move for adjournment of the Finance Authority.
Second.
Any objections? Seeing none, so move. At this point, good evening, Viva Baldwin Park.